When we approach an ECG for rhythm assessment, we have to comment on the heart rhythm, rate, P wave, P-QRS ratio, PR interval, and the QRS complex. Starting with the heart rhythm, to know it is regular or not, we see the distance between every two successive R waves, and here we can see that the distance between every two successive R waves is constant along the whole ECG, and this means that fixed R to R interval, and this means that the ECG is regular. And we know that from calculation of heart rate in regular ECGs, we divide 300 by the number of large square. If you want to calculate the heart rate, divide 300 by the number of large squares between every two successive any two successive R waves. But in the tachycardia, instead, we divide 1500 by the number of small squares. Why? Because it's more accurate to calculate the number of small squares between two successive R waves when there is tachycardia. And since the largest square contains 5 small squares, so we divide 1500 by the number of small squares. Like here, we divide 1500 by 12 and we obtain 125 beats per minute. And this is tachycardia, so the patient has regular tachycardia. After that, we look for the P wave. We have to assess the P wave in the whole ECG, not from only one strip, because the normal sinus morphology of the P wave means that it is of same morphology in the same lead, and its axis is positive in lead 2, negative in AVR, and maybe biphasic in V1. And it's different from, for example, the T wave like this. The T wave is asymmetrical. It has a delayed onset and rapid offset, while the P wave is symmetrical and its onset is like its offset, unlike the T wave. So the P wave also, we look for the amplitude and width. Its amplitude and width should not exceed 2.5 small squares in lead 2. After that, we look for the P to QRS ratio, and here we found that every P wave is followed by its QRS complex. There is no non-conducted B waves, as we just mentioned. This is T wave. This is not P. We know it from the delayed onset. The slope here is not like the P wave that is symmetrical, and so here the number of QRS complexes equal the number of P waves. There is no more P or more QRS complex like other types of tachycardia we will mention later on. Then we look for the PR interval, starting from the beginning of the P to the beginning of the QRS complex, and we appreciate here the PR interval is fixed all over the ECG strip. Also, in assessment of tachycardia, you will hear the term RP, and here in the sinus tachycardia, it is a type of long RP tachycardia. What is the RP? It is the distance between the R wave of the preceding complex, of the preceding beat, and the P wave. And the ratio between the RP and the PR is important in differential diagnosis of tachycardia. Sinus tachycardia is at the head of long RP tachycardias, in which the P wave is closer to the following QRS complex than the preceding QRS complex. So this is normal for any sinus rhythm, is the P wave is closer to the QRS complex coming after it. Okay, and this means that the PR interval here is fixed, and it's long RP tachycardia in which the RP is longer than the PR, as you see in this diagram. Finally, the QRS complex here is narrow. It's normally less than 2.5 small squares, and here it's 2 small squares, and thus the QRS here is narrow, and this is called narrow complex tachycardia. And I recommend that you see the video about how to approach ECG with tachycardia, either narrow complex or wide complex tachycardia. I'd like to remind you of the normal sinus rhythm. When do we say normal sinus rhythm? As you see, there is a P wave, and every P wave is followed by QRS complex. There is no non-conducted B waves. The ratio is 1 to 1. And if you see the whole ECG, Here the P wave is positive in lead 2, negative in EVR, and maybe here biphasic in V1, and it has the same morphology in the same lead. If you see lead 1, it has the same morphology. If lead 2, it has the same morphology. But it is not of same morphology among different leads, okay? It's here, similar morphology. EVR is similar morphology but negative, and it has different morphology from one lead to another. This is normal. And finally, to say that it is normal sinus rhythm, the heart rate must fall between 60 and 100 beats per minute. To finalize, what are the criteria for diagnosis of sinus tachycardia? It is a tachycardia that is regular, means that fixed R-to-R interval, often not exceeding 150 beats per minute, as you will know later on, and this is guided by also the age of the patient. Here the number of QRS complexes equal the number of P waves, and P wave is of sinus morphology, similar shape in the same lead, and of normal axis. The QRS complexes is narrow complexes than 2.5 small squares, and it is a type of long RB tachycardia in which the RB is longer than PR, which is normal in any ECG.